Hi everyone, welcome to AFR2. This wee PowerPoint is going to be on imaging of the lymph nodes. Heads up, I got braces the other day and I cannot speak, so I am sorry if, I'm sorry if I can't pronounce any of the words. We'll see how we get on. So, to start with, the content we're going to be looking at today. So in Try A, you did have a task as part of your tutorial to go away and look at mediastinal lymph nodes, and you were to have a little bit of a look at how they looked on CT and consideration of maybe what imaging modalities that we would use if we had to image lymph nodes. So that's what we're going to look at further today. Essentially, we're going to mainly be looking at abnormal images because your lymph nodes are quite unremarkable on if they are normal. There are some characteristics that are associated with normal lymph nodes, but mainly would be, imaging the lymph nodes because there is something abnormal going on. So the emphasis will be on abnormalities. I'm going to have to keep moving myself. So a wee refresh, you have your lymphatic system, which contains about 600 or a little bit more or a little bit less, depending on who you are, lymph nodes, and they are all interconnected with the lymphatic vessels. And essentially that is a slow flow, low pressure system that returns sort of interstitial fluid back into the blood. So it's collecting antigens from the interstitial fluid, and it's the site of kind of the primary immune response if you have something going on in your body. So as I said, there's about 600 and they're a key part of the immune system, and really they're involved in a wide variety of diseases. And when you have an immune response triggered within your body, they will become enlarged. So many of you will know what it's like to have, swollen glands when you've got a sore throat. Maybe other people have had other lymph nodes that have been enlarged, so you might recognize that feeling. Or so it just really depends on whether or not it is localized, meaning it's just in one area. So for example, at the back of your neck, if you've got a sore throat or a tooth abscess, or if it's more generalized and it's spread throughout the body. And it can be a reaction to infection. They're kind of known as reactive lymph nodes, or it could potentially be metastases. A primary tumour has spread to the lymph nodes, which is still known as metastases in the lymph nodes, or it could be that you have a cancer of the lymph nodes like lymphoma. So there's different reasons why your body will react and you will have these enlarged lymph nodes, and that enlargement is kind of known as lymphadenopathy. Okay. You'll know perhaps from your previous tutorial task in Try A that you have mediastinal lymph nodes, but we also have cervical lymph nodes, we have supraclavicular lymph nodes, we have the axillary ones under our armpits, we have mediastinal, as we say, supratrochlear, we have mesenteric, we have inguinal, femoral and popliteal. So there's different groups depending on where they are in the body. Okie dokie, so assessment of the lymph nodes. So there are other things other than imaging that we would consider to ascertain whether or not this enlarged lymph node is sinister or not, essentially. Okay, so this is a little is that called an acronym or mnemonic? Sorry, I can't remember what it's called there. So it's called all ages. So if you try and remember this, it takes into consideration the age, location, the length of time, any associated symptoms, whether or not it's generalized or localized, extranodal associations, and whether or not there's splenomegaly. Okay, so this is before we've even done any imaging. So you'd be thinking, how long has that lymph node been there for? Has it been there less than 4 weeks, or has it been there for a year but it's remained the same size? That would make you think it's less likely to malignant, although that's not a hard and fast rule, and your clinician would have to still consider the possibility if they had any doubt. You also want to think about the site, so where is it in the body? So some lymph nodes are really easy to feel, I keep going back to these one behind my ear. People will have, be able to feel them. Sometimes you can feel the ones in your groin, and it's quite common for people to feel them if they've maybe had an infection. There's others that are much more associated with malignancy, and if they're enlarged, they would be much more concerning. So your supraclavicular lymph nodes, you should never really be able to feel them unless there's something going on. Your popliteal lymph nodes, you shouldn't be able to feel them either. They are always considered pathological and highly suspicious for malignancy. We also have to consider what other symptoms, what is the patient's history if they come in with this enlarged lymph node. So if it's associated and the patient has, say, a history of drenching night sweats or fever or significant weight loss, maybe or of a rash or arthritis, that could be suggestive that there's something else going on. It doesn't necessarily have to be malignancy, it could be another immuno response, but it would be suspicious that there's something else going on because there's associated signs and symptoms. So for example, if you think about someone coming in with a swollen neck, I'm thinking of the teenagers we used to see in the hospital who would come in with this big swollen lymph node, and then you'd find out that actually they've lost a significant amount of weight, their sheets are drenched in the morning with sweat, and it would turn out that they maybe would have Hodgkin's lymphoma. The other things to think about, is it just in one area or is there swellings elsewhere? So is it generalised or is it localised going throughout the body? Is there any extra nodal associations? So, there's other parts to our immune system. So for example, the spleen. The spleen is part of the immune system and helps fight infection. So if there is a malignancy or if there is a bad infection, the spleen can become enlarged, so splenomegaly. And that splenomegaly in conjunction with enlarged lymph nodes would be concerning. So that's the kind of thing that a clinician will be thinking about when somebody comes in potentially with an enlarged lymph node. But obviously imaging does play a part, not the only part, but it plays a part in the diagnosis of abnormal lymph nodes. So we're going to start by looking at the lymph nodes on ultrasound. Okay, so there's just no good place to put this camera. So basically ultrasound can help differentiate between benign nodes and those that are maybe suspicious of malignancy. And sometimes they might be the first stage of imaging, the first line of imaging, maybe just because, the radiologist can have a quick scan, there's no radiation, all that kind of thing, and it's quite readily available. So there are some characteristics associated with normal lymph nodes. We will look at some images in a moment. So normal lymph nodes tend to be oval in shape, okay? So they're not round, they're much more oval, and they have a smooth margin the whole way round. And it would be considered that a lymph node was more normal in appearance if they were hypoechoic, okay? So echogeneity is a sonographic finding that really can be used to determine the risk of whether or not there might be an underlying malignancy, and it's not hard and fast rule. More investigation might need to be carried out if there are other things that are concerning the clinician, but if the lymph node appears hypoechoic, then it's much more consistent with a normal lymph node. And the same for homogeneous, so it's the sort of same signal the whole way through. That's also more characteristic of a normal lymph node. If the sonographer or radiologist carries out Doppler to assess blood flow, in a normal lymph node you would expect much more minimal, normal levels of flow. And one of the important things is that within your lymph node, within a healthy lymph node, you would have a fatty sort of central hilum in the middle. So if that is evident, then that is more consistent with a normal lymph node. When we look at the abnormal lymph nodes, there are some characteristics that are more concerning. So if the lymph node became more round in shape as opposed to oval, that would be somewhat concerning, that there's maybe a malignancy going on. Also, if there's no longer that nice smooth margin and it's more irregular, that would be concerning too. If it's hyperechoic, if it's heterogeneous in terms of signal, if there's increased vascularity, because we know that malignancies can have increased blood flow. And one of the main things to be thinking about would be if it's abnormal, if the central hilum is not evident or is maybe moved slightly and it's no longer in the centre, it could be suggestive that the lymph node is abnormal. So basically, if you're thinking about a normal lymph node, it is oval in shape, it's hypoechoic to the adjacent muscle and frequently will contain the fatty hilum in the centre, okay? So that's what we would be looking for in a normal lymph node. So we'll have a little look at a normal lymph node on an image. Again, I have to move myself. Okay, so both of these images show a nice normal image. So let me see if a nice normal lymph node. So I'll see if I can put on my little pointer. So this is a lymph node here, just around here. And you can see that it is oval in shape. And you can see that in here is the central fatty hilum, okay? And it's nice and smooth as well. It's not really got any irregularity. The signal is also homogenic as well and hypogenic. So you look at this one, which is also normal. It has a lovely oval shape, and in the middle you've got the central fatty hilum as well. So that's essentially what we would be looking at. We would also be looking at the size of them. So anything really over 5 millimeters begins to be a little bit abnormal, but really up until 1 it can still be normal. So anything over 1 centimeter would be concerning. So up to 5 millimeters considered normal. Over 5 millimeters, you're starting to look at other features. I mean, you'll be doing that anyway, but you're starting to think potentially 1 centimeter or over, you're starting to think, okay, this could be abnormal. So let's have a wee look at abnormal lymph nodes. So these are metastatic lymph nodes, meaning that they're not a lymphoma, they're not a cancer of the lymph nodes, they have spread from a primary tumour into the lymph nodes. So you can see they've lost that nice oval shape and they're starting to become much more rounded, especially this one here. You've also lost that nice central fatty hilum as well, which is just in here. Okay, so it's not as evident as it was in the previous pictures. And there's also irregularity around the margins, so you've lost that nice smooth circumference basically. You can see that there's now heterogeneity as well, so it's no longer homogeneous. There's differing signal, and there's actually some microcalcifications in there as well, which is also associated with malignancy. So that's what an abnormal lymph node would look like on ultrasound. So that's all you really need to know. Just be aware of the characteristics associated with both the normal and the abnormal appearance, and make sure that you can identify, you know, the shape. So you can see this is much more rounded. If we go back to the other slide, you can see that it's much more elongated and oval, okay? On the normal one, you can see here that there is the nice fatty hilum, and then if you go back to the abnormal, much more rounded, absence of the fatty hilum, and also it's irregular, and there's heterogeneity as well. Okay, so we'll look at lymph nodes on MRI. So